is just like these like little conversations. So Dylan, what can you from what everything that we were just chatting about, what can you tell us about concussions and all of the ones that you have had?
Yeah, so as an I'd say an expert in concussions, just because I've had so many of them. Um, it is one of the most fascinating things to learn about that we have no idea what we're doing with them. And it's such a, I would hate to say new field of study, but it kind of is. It's like we still don't even have a true defined consensus on like how you determine what a concussion is. I mean, I would say like we do now within probably like the past couple of years with like the Berlin consensus, but for the most part, I mean, a lot of the physicians are just kind of flying by the seat of their pants. It's like, oh, you got a headache, or oh, you got sensitivity to light, or this and that, and it's like, okay, go cocoon therapy, shut it down. And like you kind of mentioned before, the research is showing that's probably not the best thing to be doing. I'm probably going to butcher this stat because it's been so long since I've read this paper, but I want to say for like every day of cocoon therapy, it prolongs like the concussion recovery by, I want to say it's either 3 or 7 days. And so, most people are shut down for a week. So that's really stretching out that concussion recovery. And so it's an absolutely fascinating thing to study because, you go to so many different people and each person has their own take on it. And so it kind of, bounced around so many different people to where I got kind of a blend of everything. And that's kind of what I institute. So you can really break a concussion down into, some people call it like a subtype or even like phenotype or domain. Just it's really dependent upon who you talk to and which vernacular that they use. But you can put it into like the affective. So like that's one of the things, like your emotions can change greatly. Autonomic. So think like HPAG axis. So everything from like sex hormones to like your thyroid to your blood sugar control, everything can get impacted. Heart rate, HRV, blood pressure, you name it. So that's going to fall under that autonomic criteria. Cognitive, like we all, I was telling you, I walk into a room and I don't know why I'm there sometimes. Ocular motor is another thing we were talking about a little bit earlier, but just how your vision integrates with like the world. Do you call it, we call it suppression. Do you shut off an eye? And sometimes you might not even know that it's happening, which then predisposes you to more concussions because you're not going to see that hit coming if that hit is coming from the side where your eye is essentially shut off. Um, and from there we can go into like sleep and then somatic. So like your massive sleep disturbances happen. Somatic, it's more so just like your musculoskeletal, like your neck feels stiff. You might have a whiplash if you're in a car accident or if you got hit really hard. Just random aches and pains. And these things actually distort motor control. So, I mean, having a concussion, prior history of concussion is actually a factor for ACL tears or ankle sprains. Most people aren't aware of that. And then like one of the last things is just like vestibular. Your vestibular system, that balance center just kind of gets thrown haywire. And so, you kind of have to go through and test out every single one of these things. And you just have to figure out, it could be one thing, it could be a culmination of a few things, or if you're in really bad shape, it could be every single one of those things. And so this is why concussion rehab is so hard and you can't really standardize it because you'd have to subtype out and find out who fits in each domain and then apply that specific treatment protocol to that domain.
I'm happy that you had brought that up, that idea that not a lot of people know that concussions are typically linked to ACL tears, because like one of my friends who I just had on the show, um, she researches concussions, and she was detailing what happens as maybe a basketball player goes up for a layup and maybe they've had a history of concussions, and it might be a routine layup, but in general they almost like forget, or they get it kind of frozen in what their musculoskeletal system is supposed to do, and they come landing wrong, and it's like boom, you have an Achilles injury, you have an ACL injury. And that just seems like this odd connection, but it's like, no, if your brain and your muscles, your musculoskeletal system isn't really talking to one another, that can have huge implications, especially during gameplay.
Yeah. Oh, 100%. I mean, I'll even see it like when I rehab people, like just back from an injury, because it's like we've just lost, some of this control of the area, you can call it motor control, where you put them and they just have like a fasciculation, like they're just shaking like crazy. And it's because you can call it like a mind muscle connection. So right? Like we have alpha to alpha motor loops, so just making something contract, or gamma to gamma, so it's all sensory based. But we also have alpha to gamma, and then gamma alpha. So it's almost like a recurrent feedback loop where it's like the sensor of like joint positioning goes off, which then makes tweaks like, and then cause this other muscle to fire. And then it goes, oh no, we did too much, bring it back. And so you're just going to see this constant shaking back and forth. And that's where I love to keep people, because it's almost like it's in a subconscious position. Like it's really just at this point, like bottom up processing rather than top down and you thinking about it. And so your body just has to figure it out itself.
So what you're saying is that there seems to be something off with the afferent and the efferent communication.
Massively. That's what I picked up like on a lot of people. It's just like you put them into a position and it's like they just have no control, and it's almost like it's jerky. Like if you've ever done like true like long tempo reps with people just to annoy them is what I usually start with people. But we'll say like, hey, let's go like on a 5-5-1-5 like just tempo scheme, and then like you might see where they just start to descend, and then it's like and then it slows back down again. I'm like, hold on, what's going in this range? So we just put them back up into that range. I'm like, we're just gonna ISO this here. And so their body just goes haywire and just starts shaking.
And is there, when you had talked about like whatever the statistic was, every day that you have cocoon therapy, you're elongating the amount of time it takes you to get back to baseline. Is this even seen chronically as well? That some folks maybe who have had, like, I don't know, for example, I watch WWE and I think it was like The Undertaker, Triple H was like, yeah, I've had a lot of concussions, but who cares? And it's like, well, no, you got to talk about CTE and all these other issues down the road. Are there folks who have had concussions maybe as a child or during high school, during developmental ages? They didn't do anything about it. And now at 20, 30, 40, they're presenting with all of these issues, which they might have thought were normal and really aren't and are now plaguing them later in life.
I think the number one thing is tinnitus. So like ringing in the ears. Like people just get it periodically and they're just like, oh, that's weird. But it doesn't get in the way. And so they just think like that's normal, right? Another thing is like orthostatic hypotension. If you sit up too quick and you get a little bit lightheaded, right? Like that's happened. If you've been hungover, that's definitely happened. So I can I can speak to that as well. So if you sit up too quick and like you just can't regulate your blood pressure, like it's just going to drop. Like that's a reflection of that autonomic system that's greatly impacted from a concussion. And so like that can be a massive issue as well. But most people just think like it happens sporadically. Oh, no, it's not a big deal, right? Like I just need to sit up slower. Like so, usually no one goes to see like the doctor until something is usually a big issue.
I didn't know that with orthostasis because
Yeah.
I think a lot of people talk about that with respect to dehydration. Or it's
Mm-hmm.
like, I don't know, in grad school, we talked about that. I was like, oh, like, can you talk about orthostatic intolerance and total peripheral resistance and getting blood flow back to the brain? And I'm like, oh, like, it typically happens in women. It typically happens when you're dehydrated, but I had no idea it happens when you've maybe had one or several concussions.
Yeah. Just think of like POTS, because all it is just an autonomic disorder. And so like it happens way more because I mean you can go down like I'll run through this checklist with people and I'll ask them like have you ever like do you have dry eyes, and they'll be like yeah, like yeah, I have to rub my eyes every once in a while. I'm like, what are you allergic to? Well, I'm not allergic to anything. Well, the lacrimal gland is controlled by the parasympathetic branch of the facial nerve. And so if you have a decrease in that parasympathetic tone, like so to speak, like your eyes are going to be a lot drier. And so you can usually tell when people, because it's not like it's you have it or you don't. Like sometimes it's just a sliding scale. Like we just think of it as like a seesaw, but it's more like dimmer switches. Like we can kind of ramp it up or turn it back down depending on like what's going on. And so some people like you just have them, you talk to them and their eyes are super dry, and you can just put them through like some breathing exercises, or you can use like a microcurrent, like some vagal stim stuff, and they just start crying, like not hard crying, but like their eyes get watery. And they're like, what is going on? And I'm like, you're finally chilling out. And then we'll do an HRV reading like simultaneously, and we'll show them like, oh, it's like drastically increasing as we do this therapy. But yeah, so like dry eyes, stomach issues, like IBS is like another big thing that I'll see with that, just because again, like vagus nerve runs all the way down to the gut, and I'll usually see that with hypotension as well. Like so, I've been seeing this a lot more, and I've been asking a lot more people about it. But usually, my people that suffer from like IBS or they just have like Crohn's or something crazy going on, their blood pressure is inherently lower. Like it's 110 over like 70, but they don't do any cardio. And I'm like, well, that's a little bit odd. Like This doesn't make sense. And so I've had talked to a handful of other people, and they've kind of picked up on that too. I don't know if we have any data on that, more I don't know, correlation or causation, but it's just an interesting thing that I've been seeing a lot more, like in the clinic. I'm trying to think about it. Cold hands, cold feet, again, just from like peripheral resistance from blood flow. Um, yeah, and I think that's the main stuff. Like when I run through that checklist, that's what I ask. But you'd be surprised, like how many people, and it doesn't have to be exclusive to concussion. Like we all just have like stress that can downregulate that parasympathetic function. But most people just aren't in tune with their body enough to know when to pick up on the signs.
And I guess like starting up from the top, are you seeing a lot of these issues coming from the same type of concussion? Or could you almost like branch these into different buckets? Like if it was more of like a whiplash injury, if it was you going forwards, getting hit from the back, or if you're going in like the frontal plane, like a quarterback in the pocket doesn't see and they get sideswiped. Are there these different types of
I'll,
injuries?
I think that relates more to like some of the vestibular stuff, just because it's like, oh, our head gets lodged this way. Like just run through some vestibular testing, see if anything got knocked offline a little bit. Um, I haven't seen like anything that truly shows like if you get hit on one side, versus the other, if that's going to impact like finger nose finger testing for like cerebellar function. It's like one of the easiest things to kind of do. Same thing with like we run people through like a best like balance error scoring system, and so just standing feet together, close your eyes, like do they sway like a little bit to one side, and people the way that you sway also kind of determines like you could say hypofunction of like the cerebellum on that side because you're always going to sway a little bit into the deficit. Same thing because if you go finger nose finger with people and then you have them close their eyes and do it, it's like they're completely off base on that same side of that, like where they swayed into, which is like another interesting thing as well.
So with this specifically, we talked about like some of like the time courses of this is intervening a little bit more quickly with respect
Mm-hmm.
to rehabilitation. What are you seeing with short and long term memory deficits? Because I know like sometimes after a huge concussion, someone will be like, I don't remember what happened. And it's like, oh, well, what happened was that you were on your bike and, hit by a car and yada, yada, yada. Do a lot of these folks end up regaining that memory or is it kind of lost forever? And then accordingly, will they have issues with reaction time and learning moving forwards, like in school or at a job?
I think it honestly comes down to the population that you're working with. Like, so if you get someone that comes in and they're an athlete, like they're super active all the time. So I mean, like BDNF is like so brain derived neurotrophic factors, like one of the telltale things that gets bumped up with cardio, but it's also protective of your brain. So these athletes that are super fit and running around all the time, like they can bounce back from a concussion fairly quick. Like I think that's what saved me from all the concussions that I had, except for like my last one. Like I was just playing like rec league rugby at this point. I wasn't playing super competitive, so I wasn't training as hard. I would just show up and like play in the games, and I got absolutely smoked to the side of the head. And that one, I think it took me forever to recover from because I also had terrible luck. I got exposed to COVID and got COVID like the next day. And then so I had long COVID because of that. And I think it's mostly just because everything went haywire in the system. Because I got exposed so many times before that and never had symptoms, ever had anything crazy. And then all of a sudden get a concussion, get exposed the next day. And it was like, that was a wrap. So I want to say like my resting heart rate was like 150 for like 4 months.
Holy cow. Did you lose a ton
Yeah.
of weight? And like, were you always
No,
like tired?
no. I mean, I just felt like anxious, like always on edge. But what's crazy is like when I had COVID, I mean, I had a spin bike and a treadmill in the basement. So I was hopping on it. Like when I was sent home from work, I was just on that all the time and felt fine. And then the moment that I was cleared to come back to work, boom, it's like everything hit because I stopped training. Like I just went back into work and it was like everything flared. Like I could not get anything to come down.
How was like the brain fog during that
Terrible,
period of time?
like absolutely terrible. And so like this goes down like a whole rabbit hole of like stuff because when you there's a there's a doctor, I want to say he's based out of Virginia, who came up with this thing of like a systemic like immunoreactive syndrome, but not just necessarily from like COVID, but actually from repeated head trauma. And so what he was like conceptualizing is like you get a loosening of the ligaments like in the upper cervical spine, which then cause like all the muscles to tighten down around it to stabilize like your neck and your head. But the problem is like you have all these like outputs of like some of the spinal nerves, like the vagus nerve that runs through, or you have like some that tie into the myodural bridge, like at C1, C2. And so like that can massively impact the autonomic nervous system. And so he was saying like that you have to fix that before you can actually fix any of these other symptoms. So like I'd known a whole bunch of athletes that had like the long COVID presentation and like months had gone by to where it usually subsides, but they still had it. And then this is where they actually put together kind of like a peptide protocol for it. So it's vasoactive intestinal peptide intranasal. And like that drastically reduced people's symptoms from like this chronic dysautonomia that they had from repeated head trauma. Like it was fascinating. Granted, like still all experimental stuff, but from like the people that are willing to experiment on themselves, like have had fairly good success with that.
And what did I don't know like too much about like the short COVID and like the long COVID. I had COVID probably 3 times. And one of the times I had about 103 fever and it burned hot for about 1 day and it was horrible. But for the next 2 to 3 days, I was brain fogged. I couldn't remember how I got from one room to another and I just felt terrible. But then I know some folks with long COVID, how it settled into their lungs and they just had a chronic cough for a few months and they were always lethargic and tired. So what you're saying is like, for someone like you who had multiple concussions plus the long COVID, that just exacerbated the issues.
I think it did just because it knocked off that, autonomic system. Like in a sense, like everything was haywire. So it's not like I had a super strong immune system at the time just because everything was so out of whack. Because we also had a massage therapist at the company and she was in a car accident like a couple days prior, got whiplash, same thing, got exposed to COVID, and then ended up coming had POTS long term because of it.
And is POTS, isn't that like usually like a thyroid specific issue?
No, it's like a more so like dysautonomia, like just improper regulation. It's like POTS can almost develop as like a side effect from everything else too. But essentially it's like a postural orthostatic tachycardia syndrome. So like not only do you like get the orthostatic issue of like sitting up straight, but then your heart rate goes through the roof too. Which like it's just a nasty combo. And but then they have massive problem like regulating sodium as well. So like their blood volume is just like not consistent either. And so that can trigger some of their attacks.
That's insane. So I guess like with all of this, how do you downregulate your autonomic function in order to increase parasympathetic output?
That's what I'm playing around with a bunch of stuff. And like what I've like, I mean, you can do the breath work. There's like vagal stimulator devices now, whether it's like auricular or like microcurrent onto like the neck through like lesser occipital or like some of the other ones that run through. But everything would work for a little bit, but nothing would like stick. And that's what I was just so confused about. So I had a chat with like one of um, the docs that work across the hallway. And so he had been trying out like a handful of things because they were prescribing out like beta blockers and all these things. And it was like, you feel good, but then it kind of creates a couple other issues with that as well. And so he was like, well, I mean, I've been learning about this peptide protocol. Like, we can try this with you. And I'm like, I'm a guinea pig. Like, I will do whatever. Um, and my HRV like went up. I want to say at least like 30% within like the first like 3 days. Like it was crazy. And then it's just kept like getting better. And then whenever I was doing from like a breathwork standpoint or like a microcurrent standpoint or whatever, like it actually stuck. Like it wasn't like I just did it for 5 minutes and then it tanked like 5 minutes later. So everything seemed to be working like a hell of a lot better.
What was the peptide therapy?
Vasoactive intestinal peptide was what we used. And it's just like a pretty strong like anti-inflammatory, but it's like it's he was kind of describing it's more from like an endothelial perspective, because that's like also like one of the concerns with COVID is just like an endothelial inflammation. So they just use that intranasal, and because it can get through that blood-brain barrier. And he was saying like having some good success with that. So I ran that and just had like fairly good success. But yeah, I've had some like concussion patients like as well like ask about that, and I'm like, we don't really have any data on it. but everyone that I see is like wants to be a guinea pig. And so I just like, hey, go talk to, this doc because they can write you a script for it. And so they've had some good success on all this stuff. So I've been seeing people bounce back way quicker. Now these are all gen pop because you can't have athletes take this stuff, but it's pretty interesting stuff.
It's interesting that you had brought up endothelial function because I was doing my PhD from 2019 to 2023, and I was like in the latter half of my first year when COVID hit, and like we all made changes to our protocols of like, okay, like we're going to ask about COVID, and we're all going to make like asterisks. Like if we had you on a 3-month program, we were feeding you a diet which was high in sodium or low in potassium, or with my dissertation I gave people like very high fat meals, and I looked at endothelial function, arterial stiffness. And what was funny was that there were so many calls for papers and calls for research from like the NIH and the AHA saying, or even ACSM saying, hey, like we need to understand what are the effects of COVID on both macro and microvascular function.
Mm-hmm.
And what they were showing, at least at that time between 2019 and 2022, probably the last time I was really looking at it, was that COVID didn't really seem to have that large of an effect on macrovascular function, but it did on microvascular function. And you think
Yeah.
about something like the coronary arteries and you go, oh crap, like, we
Yeah.
need to look into this sort of thing.
No, it's super fascinating because I talked with, there's a cardiologist, Ted Twyman, I want to say, like brilliant guy. Um, but they were running like glyco checks like on everybody because he had it in his clinic. I forget like I think it actually is just called that, but you can like snap a picture of like the bottom side of the tongue and you can actually get a look at like the density like of capillaries and everything else that's like running through there. And that was like his big fascination, like post COVID.
Yeah. And it's like, it's funny because you like with you talking about like peptides, that's not, it's funny. I feel like people don't really understand what peptides are. And
Mm-hmm.
like for example, like a dipeptide is like what makes up, like a protein, like amino
Yeah.
acid chains make up proteins, and then we make these in the body. We can ingest them in like a pro form.
Yeah.
Um, but like people always think about like antioxidants from fruits and veggies. They might think about anti-inflammatory agents like healthy fats or some
Mm-hmm.
different supplements that you could take. But it's interesting that you went the peptide route, especially aiming for the gut because of that gut brain axis when there's these huge neurological issues which might come about with COVID or with concussions.
Yeah. It's because I've also seen some people try like some oral BPC, like in what's it GHK, like and have some decent like success off of that too. Because I deal with a lot of bodybuilders and they all like have SIBO for the most part. And like what's interesting is like we actually do have research on that, and like nobody's aware of that for the most part. Like how much it just changes like the gut microbiome, and like they're just slamming carbs like 24/7 and then on top of all the other drugs that they're running. And so like their gut is absolutely destroyed and they're bloated 24/7. And so now like I feel like every bodybuilder I talk to is like trying to hop on a peptide protocol to like fix their gut all the time.
That's one of those things, and it's interesting that I think the first video I saw was from what was it, like Lee Labrada Jr. was saying that he like blends up all of his food and drinks it in a blender. I was like, oh, it's disgusting. And he's like, yeah, he's like, after years and years and years of just pounding the exact same foods, so therefore the exact same nutrient profiles, he was dealing with like IBS and some like
Mm.
GI issues, and he was bloated. And he's like, yeah, not only do I not want to feel bloated and like crap all day, he goes, I want to look good too for getting on stage. And I always tell my students, I'm like, you want to have the New York City of diversity in your gut. You want to have the largest amount of gut bacteria. But the problem with like athletes and especially bodybuilders who might be eating 3, 4, or 5,000 calories a day for who knows, maybe 10, 20 years, if you're just doing the same copy and paste meal all the time, you could be missing these tiny little micronutrients that you didn't even know about. And therefore you're not getting this, and this neighborhood of, you know, beneficial gut bacteria. And then it presents as some sort of like IBS or some issue. And then with the gut brain axis, we know with like the gut brain axis that the gut is responsible for creating like serotonin and helping out
Mm.
with dopamine. So it's like, that's where like a lot of the depression might come from and the mood swings comes from. No one ever thinks about that. No one ever
Yeah.
talks about that.
Exactly. And that's why I think it's like interesting, because I tell people it's like my job is to throw the kitchen sink at you. Like you can't, like I would, research is awesome, but the problem is like we always have to isolate things out. But in like, in reality, you're never really isolating anything when you're in the clinic or when you're working one on one with somebody. And so I think that's the hardest thing, because it's like this person might need simultaneous approaches to get over this hump, but we're only giving them this one thing. And that's what, like, I think that's the hardest thing about treating concussions is like you just have to, or treating anything in general, is like you have to be able to address everything. Like I had a person come in the other day, we were going over, um, they just had like a chronic like supraspinatus like tendinopathy, and we just went over a bunch of stuff, and like their blood sugar was like, I want to say A1C was like 6.2, and it was like a young, like quote unquote fit healthy kid. I'm like, what is going on? I'm like, what time do you work out, what time do you go to sleep? He was like, oh, I take my pre at like 7 o'clock after I eat dinner, and then I go lift, and then I'm like in bed by like 3, and then I wake up at like 8. I'm like, dude, your circadian rhythm is all out of whack. I'm like, all I want you to do is like, one, stop doing that. Like, we're just going to switch your lifts to the first thing in the morning. I was like, if you're already fine with being up late at night, like you can wake up early and we'll just flip it. And then we dropped his A1C down to like 5.3. Like literally, I just had him just work out in the morning. That's it. Like nothing else. Like I'm like, dietary wise, like you can still do what you're doing. Like we're just going to flip that. But like, and then that is also like, then his shoulder pain got better without having to give him a single shoulder drill.
Are you seeing, this might be an interesting take, is are you seeing a lot of the same issues within the same populations? So for a lot of the younger folks, they have like a class of issues that they have going on. Some of the older athletes, some of the bodybuilders, some of the gen pop, are they like, do you kind of pocket what we see? Like, for example, like
Some
with
of
physical therapy, you see like a lot of musculoskeletal injuries, a lot of,
it.
hip pains in like the 40 to 60-year-olds, but maybe not so in the teenagers.
Yeah. So it's really like, I would say sport wise, like every sport has like their specific injuries. Like hockey, it's going to be like hip and low back and a bit of shoulder. Um, Rugby, like neck and shoulder. Um, Basketball, like Achilles and knees. So like certain sports have like their tells, but within like certain populations, like not as much. I would say um, postpartum, yeah, actually, like a bit too. Like because they, not many women are even like told about pelvic floor therapy, which is like kind of crazy. But that then usually cause like a lot of low back issues, whether it was like natural or C-section. And then what usually happens is now their breath doesn't go nearly as deep because their pelvic floor is kind of pulled up. So now they just deal with this chronic neck tension because their breathing is just becomes apical. So like certain populations will have certain things, but man, I just see so much random stuff, like so much random stuff in the clinic. So I don't think I ever have. That's a lie. I do get like string of cases where I'll have like 6 ACL tears in a row, and then I'll get like a handful of people that just come in because they're like, read the blood work, like what's going on. And then I got like a handful of people where it's just like all shoulder stuff. But it is weird. Like it does happen like that. Like 1 month I'll have like the same case from every new patient that I see. It'll be like an ACL issue or whatever's going on. But a lot of times I'm usually just getting random stuff.
Are you seeing a lot of youth and teenage athletes dealing with a lot of ACL injuries, a lot of MCL, PCL, Achilles injuries, just from overuse at such a young age or specialization at a young age?
Yeah, I would say a lot of like knee. It's more so like a quad, like tendinopathy, almost like jumper's knee, I guess. Some Achilles stuff, but I think it's more so it's just like they're not training as hard in the gym. Like we could chalk it up to specialization and say like, yeah, they're playing a lot more. But I also just think like they're not. I treat like lifting as almost like putting on body armor. Like I just need enough body armor to make it through the season. Like it's gonna get beat up, but I just that's what's gonna make me resilient. And I feel like that's kind of gone by the wayside. Like we've gone into the realm, like we've overshot our trajectory on the sports science side of things to where we've been like, all right, we're gonna monitor these people like 24/7 and pull them away if we get, as close to like 1.4 on the acute to chronic workload ratios, and people freak out, right? And but the problem is now we've also stripped them of the ability to know how to train hard, and so like a lot of these kids, like I just throw them in the weight room, and I'm like, all right, you're just going to lift with me. And it's like magically the injury gets better and goes away. And it's like, we didn't really do targeted rehab. I just put some size on you and told you to eat. That's it. And so it's just weird stuff like that, where I think that's kind of become like an epidemic as of late, where we've kind of went from like balls to the wall, just lift heavy, grind, and then that beat up everybody, to now it's like we've undershot it so much to where these kids are just like not physically prepared for the demands of the sport.
That's an interesting take. And I like a lot of the points that you put out there because I think a lot of them are kind of unpopular opinions, but they need to be said. Because I love the fact that, because I mean you're also like, you do a lot of strength and conditioning, not only like the chiropractor side, in that like we have this deep love and respect for being in the gym, putting on size, eating big, lifting big. But also there's the caveat of like, okay, you also need the rest. And with the whole sports science, I mean, sports science is like a pretty new field
Mm.
and it's advancing very quickly, especially with AI, which is brilliant. But on the other end, like I've spoken with a lot of sports scientists and they are pretty much obsessed with the wearable technologies and AI and like saying, no, like your HRV is too low, or oh no, you need to optimize your sleep. Oh, like get more sunlight. Oh, get less sunlight. And it's like at a certain point, like you can't shortcut, as you said, the body armor. And, it doesn't matter what age you are, you need to have muscle, you need to have strength, you need to have size, you need to have those proprioceptive and kinesthetic senses. So, like, I try and train my parents and their friends who are in their 60s and 70s, and I'm like, this is important for longevity. But even so, with like some of the younger folks who I coach who are like 17, 18, 19, trying to run their first half marathon or full marathon, I'm like, you need shock absorption. You need gait stability. We need to work on that. And a lot of them are like, oh, well, my Aura Ring or my Garmin told me to take a day off. I'm like, no, active recovery or like get into the gym and do something light a couple days a week. Um, it's interesting, like the camps that people fall into with these things.
It cracks me up because like one of my favorite researchers is like Franco Impellizzeri. If you've like read some of his papers, like he destroys a lot of these like novel ideas that we have around this stuff, just because he's like methodology that we used for some of these papers, for like whether it was acute like chronic workload ratios, whatever, or the Nordic studies, like just completely like tears it apart. And but it's funny because like that's what I see like in practice. Like if you talk to it, like it's, I think it's just because we're so far removed from things, like between the collaboration between whether it's like the researchers or like or those that work in sports science and like the actual skill coaches or like the team coaches. It's like they're too much at odds and like not enough at working together within things. Because like for instance, like on a Nordic curl, like I think early on the research showed like yeah, like it can reduce some like hamstring strains, but clubs have been like spamming Nordic curls nonstop, and people are straining their hamstrings more than ever. And it's like, what is going on here? But if you look at how a Nordic is executed, like vast majority of times, there's like massive amounts of lumbar extension, and then you're putting like all this load through the hammy, like the hip's not in a great position, and it's like that is literally the exact same mechanism you would use if you were running. Like you would for sure pull your hammy because you're just casting your leg out and lifting your chest up. Like it's the worst thing for you. Not saying like the Nordic is a terrible drill; it just has to be executed to like perfection. And most people, once they get fatigued, like that goes out the window. And so, I mean, going back to your point of like the Aura Ring and people freaking out because it gets low, like I train fighters, and early on, I probably want to say like by 2017, like was implementing like utilizing a lot of like this HRV like tracking wearable stuff. And then within some of these fighters, we got into this issue of every week, every camp, like their HRV starts to tank. And it's like, well, they're cutting weight. So obviously it's going to be pretty bad. And their training is ramping up and everything. So it's never going to be pretty. And so I got to the point where I'm like, I don't even want you guys to read the data. Just like, give me your phone and I'll look at it. And then, because then they would get freaked out about it because they started to learn about a lot of that stuff. And so it gets to a point where they just become hyper focused on it to where they can't execute. In the days where their HRV was terrible, they did great in the gym. Why? Because it's sympathetic. Like that's all it's measuring. Because we use like vast majority of wearables just use like an RMSSD, which is more so just reflective of like parasympathetic function if it's really high. Well, if it's really low, you're sympathetic. So you're going to be insanely strong in the gym that day because you're more wired up. And so like people just don't realize that. I'm like, there's times where I want your HRV to be terrible. like quote unquote, but I think we just get hyper fixated because we don't fully understand the metrics. Like we look at it from like a health perspective, but like health and performance are not the same thing. And I think that's where people get so confused. Like I draw out a Venn diagram on the board with every athlete I get in, and I say, here's what we have. Like you have like your aesthetics, you have your health, and then you have your performance, right? I say pick two of these to live in because three does not exist. Like that is the Vitruvian man, right? Like that's not going to happen in real life. If you pick three, you're going to suck at all three. Just pick two. And usually, like early on in your career, it's aesthetics and performance, right? And then later in your career, you go performance and health. And then towards like, and once you're done with the sport, then it's just health and aesthetics. And so we just kind of navigate, and I have to like have an honest conversation with people. Like, where do you think you're at? Usually by the time people get to me, like they've already racked up a few injuries. So we're in that performance and health thing. And so the convenient thing with me is like I train athletes, but I can also fix the athlete. And so I know how hard I can push somebody before they break. And even if we get close to breaking, I can still fix it. So I don't freak out. Whereas like if you deal with someone who's strictly rehab, like they're not going to push them hard enough in the rehab. And then if you get a skills coach or like a strength coach, they might push them too hard and then it sets them back and they don't know how to fix it. So I tell people it's like Icarus. My job's like, you just got to fly as close to the sun and hope you don't get burned.
I recently had Mike Young on the podcast, and that guy's brilliant. He's like, his whole thing is bend, don't break.
Yep.
And he's just like, yeah, he's like, I have these professional soccer players coming in sometimes in their late teens, and they think that they're all that in a bag of chips because they're on the club at 18 years old. He goes, yeah, but I'm in charge. And I love like the way that he integrates the sports science with a very hard nosed mentality of like, I'm going to really, really, really push you in the safest way possible. And when you feel like you're going to break, boom, let's deload. And that's what the super compensation effect is going to be.
Yeah. And I use that like fairly heavily with my guys, especially going into fights, like where we pull back on. Because I'll also use just like surrogate measures as well. Like we might use um, like a like a convergence test, like simple as like bringing the finger in and then like seeing where their break point is. Like when does it split? When does it get blurry? Because we'll do testing pre-camp to see where they're at and when they're perfectly like healthy. And then like I can tell when they're getting stressed, brain's getting stressed because like near points convergence stress is like one of the biggest things on brain health. And so we can, objectively track and to see, okay, like, oh, we've really fallen off. Like it's now back here. Let's rein it in a little bit, right? Like I don't need like Whoop to be able to tell me or your or I can see it in real time, right? Like my first ever like Boston strength conditioning, he goes, just give them a handshake. He was like, you will be able to tell their readiness just by their handshake, right? So we always used to joke around with the athletes, like we give them a handshake when they walk in the door, and then you'd laugh at them and be like, that's all you got, and have them try and break your hand. But what do we use now? Like the hand grip dynamometer and see if they're within range, right? We've been doing this stuff for ages. It's like now we're just putting numbers to it.
One of my favorite like things to think about in like with my like client base, and I think like you're kind of on the same wavelength as well, is I can't say how many baseball players who I've trained, both high school and collegiate, and they were just obsessed with their aura rings and their Garmins and like their different wearables, and they're just obsessed, obsessed, obsessed. And I'm like, you play baseball. Like baseball's an awesome sport. I'm a huge Philly fan, but like most of the time you're sedentary. You're waiting for your turn to bat, or you're just sitting out in the outfield. You're just standing there or sitting there. It's very highly skill based, but like then I train ultra marathon runners who might be running upwards of a marathon a day. And that could include 5,000 calories and the stretching and the lifting and maybe 8 to 10 hours of sleep. And it's like the Garmin is screaming at you to like take a rest day. And you're like, maybe I'll do some active recovery in like zone one and I'll feel okay. And they do an hour or two session and they're fine. And I'm like, I love that mentality of being like your own scientist and your own coach, of being kind to yourself and still doing the recovery techniques with the foam rolling and the healthy nutrition and maybe taking like a contrast shower or something. But like, I hate like the mentality of like a baseball player who's like, oh, I need to take an off day. I'm like, you stand in left field, relax.
And I think you got to get like in sports where people have been pushed to the absolute breaking point to where they know where now the breaking point is, right? Like the joke is always like, oh, we're going to train optimally. Like you don't know what optimal is until you've actually gone so far that you've broken something. Because now you know where the breaking point is. And so, I mean, I remember being put through like conditioning sessions for rugby, and it was to the point where it was like I might want to roll my ankle jogging down this hill so I can get out of this session. I was like, that's how bad this thing is. I would rather be out for the next 2 weeks, than have to deal with this. But that's like the whole point is like, I want to push you to the breaking points where I know, okay, we found it. And then like, let's work out a certain percentage of that. And so even if your aura ring tells me like, oh, we might be here, like I know we have enough to keep going a little bit further.
There was one of my favorite like sort of things to like go back to is LeBron James, and like he's been playing since we were kids. Like I had a
Mm-hmm.
poster of him in my bedroom when I was 7 years old, and now 23 years later, he is still playing basketball. He's still dunking over people, and it blows my mind like the longevity of this guy. And I've been obsessed with his protocols and what he does, and like the coaches he hires, and the food he eats, and the cryotherapy, and the massage therapy, and the bands. It's insane. And have you ever seen his like a dunking routine that he did with his son, where they
No.
basically run from like half court and like someone passes them the ball and they sprint and they dunk the ball right side, left side, right side, left side. They do that for like 2 hours. And I'm like, what? You're basically just doing repeat sprint drills for 2 hours. And it's like, yeah, that's what it takes. And he goes and takes a nap and he goes, does something else. And he's been doing that for like 20, 30 years. And I'm like, that's incredible. And some people go, oh my gosh, that's too much. It's like, well, it's obviously working for him. That's his point.
Yeah. That's like it's really common in rugby. Like if you haven't made like the top level yet, that you're going to get like a daytime job or something else. So like there was a story down in Australia where like they're in the NRL. This kid was coming up, and he would go like work as like in the grocery store, like or in like a shipyard at night, and then like go to practice during the day, and then like just do this back and forth. And it's like if all you know is just how to win, like you're gonna find a way to get it done. And so like your mind can override a lot of that stuff. And I think that's just to the point where I think that's the biggest holdup within sports science is like it's just measuring the capability of the body and not necessarily the mind. And the more that like we push people into these breaking points, like then you can really start to see like where they fall apart at. But yeah, if you look at it and be like, this is crazy, like, that someone can do it for this long. And it's like, well, no, that was the standard back then. Like you just upheld the standard and now that's the norm. And so I think we're into the era of just building racehorses and not workhorses. But like what happens when a racehorse injures their leg? You take them out back and you shoot them, like their career is done. Now we humanely put them in the pasture, but like they don't serve a purpose, right? But like a workhorse, like it's doing stuff all day long and they last forever, like forever. And so I think now that's the problem is like we're too finely tuned to the point where we become racehorses to where like the smallest thing now sets you back. Whereas like a workhorse can handle anything.
It reminds me of a friend I have who's he's probably around 71 right now, maybe 72, and he's run over 600 marathons. And among those, he's run over 100 100-mile races. And the man's
Jeez.
like 71, 72. And I've run several ultras with him, several marathons with him, and I've been with him there through the middle of the night. And it's funny seeing this guy because, like, from the outside, he just looks like this kind of wrinkly guy who's like 70, 71, 72. And he's just pounding miles and miles and miles and miles and miles. He's always posting on Facebook how many hundreds and hundreds of marathons and ultra marathons he's done. And I talk with him. I'm like, what number are you at? How you feeling? Like, what's the next race? And for him, it's like he's getting upset because his performance is slightly declining over the decades. And I'm like, you're 71, 72 years old running 100-mile ultra marathons in like Death Valley, like he does Badwater in California in the middle of July. And it's like, if that's his standard and that's what the body can uphold, then it's like, then go do that. And like, I wasn't expecting to talk about this today with you, but like, this has been so much fun because it's like, yeah, like we still do need to have that educated, but very high agency mentality of saying like, if this is the David Goggins bar, maybe this is just the bar. Maybe it's not the David Goggins. Maybe that could be me too. And it's like,
Yeah.
if you want to take your school performance or business performance or athletic performance up to that level, then it's like, well, then start progressively overloading up to that point. Like, I don't know, Kobe Bryant did as an example.
Yeah, exactly. Like I can't tell you how many athletes I have that have been in the game like for a long time, and it's like it's not because they do anything like super special. It's just they're so consistent with their training and they push the bar so high and they don't back down from it. Like that's it. That's the only thing that changes.
One thing I'm curious about to know from your chiropractic experience and your strength and conditioning experiences, what is your what is your take on back squats? Are you a big fan of them? Is it contingent upon what their goal is and what the population is?
Yeah, like I think it's really it's dependent upon the population. For um, sorry, my wife just came home. My dog's freaking out. So I think it's really dependent upon like goals of the person, and then especially for like athletes, it's more so looking at it from like an orthopedic issue and like certain sports. Like if our knees are chewed up or our hips are chewed up, like it's probably not going to be the first thing that I go to. Like, but I do want you to have that movement pattern. So like we might not train it right away. We might just address some of like the deficiencies that we have and then throw it back in. Like I have a kid um, who like phenomenal fighter, like undefeated, has like he's had like a little bit of some knee and like hip stuff, just the way that his hips are made, essentially. Like when you table test him, you're like, this doesn't make any sense. And so, like squatting him, he's like, I haven't been able to squat like since high school, and like if I squat over like whatever 200, like I have really bad knee pain, and so he hadn't squatted in like 5 or 6 years, and so we trained him, and I didn't make him squat for like an entire year, and then I threw him under the bar, and like he could squat 315, like no problem. And so, like I always tell people, it's like if we just fix up some of the little deficiencies, it makes it easier to then go into the main lift. And so I think we get into this problem where we just like pigeonhole people and we're like, just go do this lift. Like, cause this is the king of all lifts. And it's like, yeah, it's an awesome lift. Like if it's for the right person, but if you're just trying to jam like a square peg into a round hole, like you're going to cause some issues long-term with that.
And are you seeing any issues specifically? Like, what would your, I'm sure you hear this all the time, but when someone comes to you and says, oh, my lower back hurts every time I squat, would you simply say, don't squat? Or would you want to see them squat and say, okay, we could do a front squat, we could just do a body weight squat, a goblet squat to work around that? Because some people like biomechanically just have awful form, or maybe their body isn't like contoured specifically to doing a high bar back squat or a low bar back squat.
No, like we'll get them back to squatting and do like I want to see them squat because ultimately like it's one of the easiest things to put on size is to squat, like especially for your legs. And it's usually a required lift amongst like, every organization. So like this person has to be able to do it at some point. Um, but for me, like I want to see them squat and then we're going to play around with a couple different variations, but I want to see if we can just maybe tweak a few things. Like something as simple as like foot pressure. Like early on with the days of like CrossFit, it was like just drive your knees out, right? Like make room for your hips. Well, the problem is like you can't properly pronate your ankle or pronate your foot if you're driving your knee out because that's going to create supination of the foot, which is going to actually lock the front of your ankle and block dorsiflexion. So sometimes I'll just literally put like my like a sock under their arch of their foot and I'll say, hey, just press down and drop down to the ground and come back up. And they're like, oh, I don't have any back pain. Like so, it could just be something as small as that of like learning how to push through our foot. Other times it's like learning how to leverage like rib cage position, like, the old school lifting days of like get on under the bar, pop our chest up, like stare at the ceiling. Like you're just leveraging the erectors. And all that's going to do is just crank on that over time until right now, you're like only learning how to drive hip extension from just you arching your low back, not actually driving from like your hip. And so just training that out of people like makes a big difference too. So we might play around with some like Jefferson curls or some other like variations of like a slouching split squat, or other things, or like playing around with like a safety bar in a rounded position to get you to actually drive from your leg and not, you can't like pop your chest up while you're doing it. So it's just like finding what the deficit is and then just attacking that and then reintegrating it back into the lift.
Now, I think that's a very scientific and fair way of saying that too. Like I always like to give people like a 5 pound weight and put it underneath of their heels. And I was just hearing someone talking about this with like squats specifically, that squats are a very difficult movement to explain to someone how to do, but it is so integral just for like your core strength, your leg strength, like everything that you do. It's a very functional lift if people want to use that term, but we all need to know how to do these lifts properly and with as little pain as possible. And I even look at it from the standpoint of axial loading deep into life. So even though like some folks aren't like the biggest fans of back squats, and I've definitely backed off as like I got into like my late 20s because I'm done squatting upwards of 315, and dealing with some like little aches and pains here and there. But even from like the axial loading perspective of, can I just continue to squat, 205, 225 for the next 20 or 30 years and maybe not have to deal with as much sarcopenia and osteoporosis in my cervical and thoracic spine as I age?
Yeah. Like I think it's really just kind of like a plug and play for each person. Like you talk about like even like manipulating like the ankle and stuff like that. Like I use wedges like heavily. And depending upon what I'm seeing from the person depends where I put that wedge or that plate. So like the reason that the plate works really well is because it shifts your center of mass forward a little bit, which then you're not going to want to fall over. So when you squat down, you're actually going to shift your center of mass back a little bit to then stay over top your ankle. Like that's why the plates or the wedges work really well. But sometimes if I want the foot to move more freely, I'll actually put them all the way up on the wedge. So you have to get a long enough wedge for that to work. But just playing around with that can actually like ease up some back pain too. So it's like a 2 for 1. Like we can reinforce the skill, but then also like eliminate some pain in the process within that. But like you said, you don't really have to like jam someone into this thing. Like I have spondy, so a fracture like in my low back. Like there's days where it's like squatting doesn't feel great, but I'm still like a washed up meathead, so like I'm gonna want to do it, and so I pay the price for it. But it's a fun thing to get under the bar every once in a while because you get the itch for it. But I realize like probably don't need to do this, so I'm just going to switch these out for like some Bulgarian split squats with dumbbells or some like kettlebell swings or whatever I need to do. So I always tell people, and especially like my interns, like chase the adaptation, not the exercise.
That perfectly goes into like a stimulus to fatigue ratio. Is if like you're doing an exercise which is like the grand master of them all, but you're not really feeling it, it's like, okay, fine, then do something else. And like it's funny, I recently started doing the leg press machine, not like the leg press when you're like you basically down on the floor at an angle, but the actual leg press machine. And
Yeah.
like the amount of quad stimulation I get from that is unbelievable. And there's like no setup. You literally just put the pin in like the little holder as opposed to like actually like loading up the 45-pound plates. And I'm like, wow, after 12 or 15 years of doing this, like now I feel like this insane pump on my legs. And I can even do like drop sets if I want to on this. This is amazing. But it took a little bit of like cognition, a little bit of like humbling myself to be like, I'm going to get on that machine that all the old folks do.
Yeah. And it's funny because it's like we just think of it as accessory work. Like, we'll do it if we get to it or if I have time for it. But like for me, a lot of times like the accessory work becomes the main work. Like I want to fix up what little deficits I have in this person or that person. And so just like jamming them under a bar where they're just going to dive into their compensations that they already have is not going to help this problem. So I'm just going to throw them in, like right away into the accessory work to load up these areas to fix these little things. So then that we can go back into like under the bar and it looks way cleaner.
How specifically has your training changed as you've gone throughout your high school, collegiate, post collegiate career with all your concussions, some injuries, but even just like the amount of knowledge that you've had with training yourself and training all your athletes? How has that changed in the past 10, 15 years?
Um, I would say like early on, it was just train really hard. And I think like we talked about earlier, like you got to find that breaking point. Like that's what I lived for was like finding that breaking point. And so I towed that line very finely from like 16 all the way up until like probably like 22, 23, like when I broke my back. And then it was like, okay, you can't really lift because the spondy was super active. So I was like, I don't know what I'm going to do. So then you kind of back off of it a little bit. But I was still playing at the time. So it was like, I still needed to. That's when I got more into doing the accessory work side of things. So I'm like, oh, I can do this and it doesn't hurt. So then I just got into that habit of like changing up into that. And then I would say the more I learned, probably the smarter I got, the worse I got at lifting at some point. Just because like you get so caught up in like stimulus to fatigue ratios and like what's the optimal way to do this. And then like you take a step back and you realize it's like, oh, I should just lift hard like I used to. And then now we're back into that swing of things where it's like just get under the bar and lift or like pick like your accessory work or do whatever and just train it really hard until you get tired. So it's like I would say it's kind of just come back like full circle into things. Like yeah, like I have a smarter reason for doing certain things. Like again, like train the adaptation, not the exercise. Like fit the drill to the person, but like you still have to train it hard.
I feel like what all the education and experience has taught me, and it sounds like with you as well, is the ability to auto regulate.
Yep.
Instead of like having to Google things or watch YouTube videos or ask questions, you go, huh, I'm feeling this little pain here, or I'm not feeling this, or, ooh, I could add this in. So you do, and it's fine. And I think like that was what the education gave to me and all like the years of experience. And like, I wouldn't trade that for anything, because there's
Yeah.
some days I want to absolutely crush it. And I'm like, oh, I'm doing 2 or 3 extra exercises of my bicep and tricep training because it feels great. And other days I'm like, no, I can kind of back off from there. I've done enough. And it's completely fine.
Yeah, no, I'm kind of in the same boat with stuff where it's like you just want to, send it some days and you're like, well, maybe I don't have to the other days. But what's interesting is like the days where I'm not pushing it hard, like on the weights, it's like maybe I just want to do more cardio that day. So I'll hop on the bike, hop on the Airdyne, or do whatever. And I think that's like the flexibility of things. Like you realize it's like it's kind of a tug of war, so you can do a little bit more cardio this day or whatever. So you're not as restrictive. Whereas like when you were, an athlete in college, it's like here's your plan, like follow the card, do everything on this card. Do not come back to me if you don't do the card. So I think that has changed like a whole bunch. Especially like doing the cardio stuff. I feel like as a meathead early on, it's like you don't really want to run, but I played a sport where I had to run, so then I got really good at running. And then as soon as I was done playing the sport, I'm like, I'm never running again. And so now I'm working my way back into doing a little bit more cardio where it's fun again and not just because I have to do it.
Do you have any plans for races coming up?
No, none whatsoever. I was just joking around with someone about that the other day. They were like, "Do you want to run a half with me?" And I was like, "Absolutely not. Like anything more than like 500 yards, I'm out." I was like, "But I'll still do airline sprints." But I'll hop in like every once in a while, do some cardio with like the athletes just to be able to talk a little shit, but show that like I can still push it with them because they're not going to complain if I do it with them. And so whether it's like prowler sprints or some stuff on the Airdyne or some like longer like hit intervals, stuff like that. But yeah, as far as like running, just like not as much, man. I've blown through. Let me see, low back fracture, broke stress fracture in the femur. That was from running. We had like a old school like Green Beret who just ran us into. That was our conditioning coach and just ran us into the ground and had a stress fracture in the femur within like the first like 2 weeks of training camp because we were hardly eating because the food was so gross at school. Um, and then pretty much blew out like every ligament in my right knee, and then tore hammy off the bone, so avulsion fracture on the ischial tuberosity, and then tore part of my lateral gastroc. So that's all on the right side. So it's like I'll notice it for sure if I do a little bit too much running.
Any bilateral deficits?
There's got to be a massive. What's really funny though is like, oh, it's not funny. It's actually kind of sad. My right leg is actually so much stronger, and I think it's because so when I had the spondy, I was having a bunch of weird nerve stuff, and it was switching like side to side, so nobody could figure what it was for like the longest time. To the point where like the doctors at school were like, "We think it might just be in your head," and I was like, "Oh, awesome, thanks for that." And it's not until I like found a doctor like who was really good with sports med, and he got the MRI, and he was like, I think that actually is a little bit of spondy. And then I listened to a lecture from Stuart McGill that talked about when he was in his lab working with the powerlifters, and like one of the guys, they buckled under pressure, but they could see like when they were like mapping out some of the blood vessel stuff too, like where if the erector got too much of a pump, they would get a almost like an occlusion, like of like what the Batson's plexus, like of the veins that run through like around that spinal cord. So it would just engorge, and then it would like it would impose upon the spinal cord, and then they would get like spinal stenosis like symptoms, even though it was functional and not structural. And that's essentially what I was running into. Because we would do like a beep test, and then it would hit like 17, 18, and I would just like collapse because my low back had such a pump and I couldn't feel my legs. But then you'd lay there for 5 minutes and it'd be fine afterwards. And it was just like nobody could explain it. And so that was such a like an interesting thing on the rehab side of things as well. But that ultimately is like whenever I try to lift, it's like I just got stuck with that like neurological thing where like my left leg, anything I pull over, I still deadlifts, but like anything over like 315, like my left leg shakes like crazy. My right leg, I feel like I'm 80% of my weight is on it. It's just like it's a weird like protection mechanism. And I still have like sensory deficits off that left leg.
Do you think that is really a combination to round things out between all of your concussions as well as the musculoskeletal injuries?
Yeah, probably. I'm the worst at rehabbing myself. So, and I think it's more of like I just do it for like a marketing thing, so like patients can understand like what I'm talking about. Because I'll be like, I'll show them, I'm like, this is a good hip, like this is how a hip should move, and then I show them my other hip, and I'm like, this is a hip that needs probably replaced in 15 years. Like this is what you don't want, and so people understand that, and so they get a good laugh out of it. But yeah, it's like I'm the worst at rehabbing my own injuries.
That's incredible. What to round this out for the day, what's in store for you next? Any
uh,
projects on the horizon, or any advances that you would like to see in chiropractic care, strength and conditioning, sports medicine?
I would say the biggest advance, obviously, the kids on the way. So I think that's probably going to take up vast majority of the time. Super excited for that. And then I want to dive deeper, like into like some of the vision and concussion stuff, and especially like the dysautonomia. It's like it's such a unique thing that we don't really study, and I've had a lot of people like come like and travel to me just because I've been seeing a lot more of these cases. But I've been picking up on patterns, and I haven't found it in the research because it's again, it's not an easy population to study, and it's so varied. Um, where like a lot of these people, like when they get an acquired like dysautonomia, whether it's from like COVID or something else, it's like their vision becomes, they develop like an exophoria. So essentially we have a thing like a Maddox rod, so we can put this little thing over your eyes, we shine a light at it, and then I tell people like point to where you think that light is at, so it actually shows me like your true ocular alignment from your brain and not just like what you're seeing. And so a lot of people, like they're not straight on, their eyes are actually almost like bug-eyed, like when they have this type of dysautonomia. And it's fascinating, and I really don't know the reason why like it starts to occur and develop, but I know like convergence is really stressful on the brain, so maybe that's like a protection mechanism, so their eyes tend to like go the opposite way and diverge. But I would say like finding some study in that would be like absolutely fascinating. And same thing, just like cracking down on more of the vision stuff, like it's just such an interesting thing, and it's such an underrepresented field, whether it's in like concussion rehab or sports performance.
I'm seeing more and more about the vision training. There's a guy, Dr. like Applebaum.
Oh yeah,
I
yeah.
was chatting with him a couple of weeks ago about having him on the show, and he's big into the whole vision training. And I guess now that I've been speaking with more people about it now, like my brain is in tune with all this vision training stuff. So I'll be really excited to see where the advances in this field happens, because I've he was talking about how the more that you stare at screens all day long and your field of view is like very narrow and you're looking at this blue light, you essentially are straining your brain, which is like a little
Yeah.
bit more work to do. And then like the rest of the day, you might have like a little bit of vertigo, a little bit of brain fog, and you really need to take like this wide view gaze out, like out of your window. So I have like a lake right outside my house, and for like a minute or two, I kind of just try and look at the lake and look at like the perimeter of it. Am I seeing anyone fishing? And to kind of broaden my horizon, so to speak, so I'm not like creating this tunnel vision for myself.
It's a super interesting thing, 'cause essentially that's just near point convergence stress, and convergence is like the most like taxing thing on the brain to be able to track something in, and then at the same time like make sure both eyes are not suppressing, so one eye isn't just shutting off. And so I'll actually have people, and the other thing is sometimes people just can't keep tightening up the lens to be able to track something in, and it's because they're already tight because they're focused on a screen all day long. So like the key is actually to get them to relax, like you said, staring out the window. There's an old school trick, so this is from Bates, who is like a German optometrist back in like the 1920s, right? So this super old school, but all he would do is he would take people and he would have them press like their palms in lightly into their eyes and just tell them to focus on the black. Because what happens is like it's the same thing as like massaging a muscle, like the extraocular muscles are getting relaxed because you're putting pressure through them, but you focusing on the black also relaxes the lens. And so like your eyes can actually just fully relax, and it'll be blurry when you come to, but like you'll be able to read stuff that's a little bit further away than what your normal vision could. And so I use that as a check sometimes with people. And so like I'll have athletes do that, especially like it's a TV timeout, or like we're skating up to a face off. Like you'll see some of the guys I work with, like they'll put their palms, like their gloves up to their eyes and lightly press into their eyes for a couple of seconds, because you also stimulate the oculocardiac reflex, so it drops their heart rate and their blood pressure at the same time. So we get the win-win of like not only relaxing our eyes, but immediately relaxing our body.
Wow. I'm gonna have to look that up. I'm gonna definitely make a note of that to look that up. That's incredible. Where can people find you?
Um, would say Instagram, but I'm really bad about using it. I promised myself that I need to be using it a lot more. My wife's making fun of me because she knows it's bad too. So I made a promise to myself. I'm going to start filming like some stuff that I'm doing with some of the athletes, or doing some stuff on some of the concussion things. So I would say Instagram. I'm super open to answering like DMs or questions on stuff too. So I think it's Dylan underscore Seeley DC. That just tells you how little I use it for anything like
Well, I
purposeful.
think it's this. No, I mean, either way, I'm gonna link it down below because that's how we've been chatting for the past couple of
Yeah.
weeks.
So yeah, I'm super open to chatting to people about like whatever. If you can manage to find me, I'm kind of a ghost, so it's like there's not a whole lot out there on me. And then like the website, I think you can like chat and email through that as well. Answer kind of like whatever questions on that stuff as well. But yeah, I'd say probably like the email or the Instagram is probably the two easiest.
Dylan, this was awesome. I'm happy that we could finally sit down and have this conversation today. This took like so many different turns, but it was really exciting. So thank you for coming on today.
Yeah, no problem, man. Welcome to my daily life. Just get a different thing to talk about every 20 seconds.
Alrighty.